Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. It's our COVID-19 briefing for British Columbia, or update for British Columbia, for Wednesday, February the 23rd. We're honored to be here on the territory of Lekwungen-speaking people of the Sunghees and the Esquimalt First Nations. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon, and thank you for joining us for this week's COVID-19 pandemic update. Last week, we announced, as I'm sure many people know, the easing of some of the orders and restrictions that had been in place, particularly the ones that had been in place over the last month and a bit as we learned more about Omicron. And we continue to see that things are leveling off, although we are still, of course, having challenges in some areas of the province. Our progress, though, remains on track, and we are continuing to see this steady decline, and these are positive and encouraging trends. And as you know, we have committed to reviewing things in the next few weeks with the goal of removing additional measures as soon as we possibly can. And another important and positive note today, our management strategy, as you know, is supported by a number of vaccine and treatment options, some of which have become new, and we anticipated that there'll be new both vaccine and treatment options to come in the weeks and months ahead. However, we do know that last week Health Canada approved for use a new class of vaccinations, one called Novavax. This will be available in BC in the next few weeks. We don't have it has not yet arrived, but we are expecting to have it in British Columbia in the next week to 10 days. And I think this is really good news. This is an important new, different class of vaccinations. It is what we call a protein subunit vaccine. It's another option for people who require immunization who've not yet been vaccinated and need it for work, or for people who are healthcare workers, for example, for people who have had a reaction to an mRNA vaccine. This is a perfectly good and valid option to make up those doses that you need to get full protection. This is an interesting vaccine. It's one we've been watching for some time, and it's no human-derived materials were involved in its development. It uses an insect cell line, which is really cool, a moth cell line, and it also has an adjuvant that's made out of soap bark tree extract. So it is plant-based as well in part of it. And what it does, how it's different from the mRNA vaccines, they give the genetic code for the spike protein of the SARS coronavirus 2 virus, and your body then generates those proteins. In this case, the proteins are the virus, baculovirus is used, and it generates proteins that are then purified from these moth cells, and the proteins are put together with this matrix made out of the soap bark tree extract, and so you're given the proteins directly, and those stimulate your own immune system to develop antibodies, both antibodies and cell-mediated immunity against those proteins. So this is a more traditional type of vaccine. We have a number of other vaccines that use similar protein subunit technology, including some of the influenza vaccines, hepatitis B and zoster. So it's a tried and true methodology of making vaccines, and we know the immune system responds well. The data that we've seen that Health Canada has proved show it's very efficacious as well. So the efficacy in the trials is upwards of 90% in preventing infection. So this is great news. And another really important thing, it's a fridge-stable vaccine, so we don't have all of those issues that we had in terms of needing to have ultra-low temperature freezers, etc. We will, like the one-dose Johnson & Johnson, the viral vector vaccines, it will be available primarily through pharmacies and some of our health authority clinics. But if you are interested in the Novavax vaccine, the best thing you can do is call right now our COVID line, the COVID-19 vaccine line. So that's 1-833 838-2323 and tell the people that you're interested in getting the Novavax vaccine. What we'll do is make sure we have your contact information, and when the vaccine is available, your dose will be reserved for you in either a pharmacy or a clinic close to where you live, and you'll be able to get that as soon as it comes in. So I think this is fantastic. It's another really important tool that we have now in our toolbox that's going to get us through both this Omicron wave, but is also going to get us through what comes next. Because we know that the importance of the protection that we get from vaccination is one of those things that has made sure that we can get through this. For those who've not yet booked your booster shot, I strongly encourage you to book your appointment at your local pharmacy in particular as soon as possible. As more and more people have been vaccinated, our demand in our large clinics is ramping down, and so the COVID-19 clinics will be focusing, the health authority clinics will continue to focus on the 5 to 11 immunizations particularly, because we know there's important things that we need to have in those clinics to support families and children. But adults can get any of our available vaccines at local pharmacies. In addition to additional vaccine options, we also have, as we talked about 2 weeks ago, an additional treatment called Paxlovid that is now available, and we have got a little bit more supply in the province, in addition to Sotrovimab, which is a monoclonal antibody. And there are additional monoclonal antibody treatments that are approved for use and are going to be available in Canada in the future. These are especially important for people who are at high risk of having severe illness and hospitalization if they get COVID. And particularly it includes people who are older, people who have immune-compromising conditions, and for those people, we know you as clinically extremely vulnerable. You've got those notes. We made sure that you got your vaccines early, but we do know that some people, even with 3 doses of vaccine, even with a booster dose, don't have as strong an immune response, and so these treatments are available now for you. They're also important for people who are not yet fully vaccinated, and people, especially if you're over 60 or you have other underlying illnesses. So these are a positive step forward, but as we talked about as well, like all medications, they're not suitable for everyone. In particular, Paxlovid has a number of interactions with a number of medications that people may be taking. So to receive either of these, you have to have a positive COVID test and a PCR or rapid antigen test, and we are prioritizing people who may need these treatments to be able to get PCR tests. And the treatments need to be started within the first few days, the first 5 days in particular of your symptom onset. So today, we have had access through infectious disease physicians in different parts of the province, and I want to thank them for the work that they've been doing. But we are also now setting up a self-screening tool that is now available and our call support center, so that people across the province can determine if this is a treatment that would be right for you and how you can access it. So to request treatment, and we'll send the link around, there'll be a 4-step self-screening tool that you can go online and find out if this is either of these are treatments that might be suitable for you, and a virtual assessment service that will now be available through the province's COVID-19 Information Center around the province. So we'll be sending out the links to those information and posting them on our COVID-19 websites and on the BC CDC website. These are important to help prevent severe illness, but it is also a reminder that the most important thing we can do is preventing getting sick in the first place, and that of course means vaccination. It is our most important tool, particularly for older people, for people who have reasons that make them clinically extremely vulnerable to COVID. We know, and we've presented these data, that 2 doses remains very, very effective at preventing severe illness, even 8 months, 10 months later. And we know now from data from the BC CDC, from data that's been collected as well in Quebec and other parts of the world, that that booster dose makes a difference. It makes a difference in boosting that prevention for severe illness and hospitalization, but it also prevents transmission. And it's about 60%, 70% effective of preventing any symptoms at all. And in Quebec, they looked as well. It's about 80% effective. If you get that booster dose, it reduces your risk of needing to go to an emergency department because of symptoms because of COVID. So we do now have good, strong data that tells us with Omicron that getting that booster dose is important. It prevents you from getting sick at all. It prevents transmission, and it prevents illness. So please, if you've not yet, if you've been invited, it's been 6 months, go out and get that booster shot. And if you have concerns because of a reaction perhaps to your second dose of the mRNA vaccines, it is an option to get Novavax as a booster dose, depending what other vaccines you've had initially. If you've not yet had your first or second dose, even if particularly if you're a young person, 5 to 11, please talk to your pediatrician, talk to your pharmacist about the importance of protecting young people from illness as well. We still have a lot of this virus that's circulating, and this protection is good, strong, safe protection and long-lasting, and it will help us for what we're dealing with now, but also as we're going through this transition phase and into the future. Testing, of course, continues to be part of our ongoing efforts. And last week, it was shared that we finally have received quite a lot of the at-home tests that are available for people. These are rapid tests that can be used by people at home, and they'll be distributed. They've already started through schools throughout the province. The tests will soon be able to we'll also be distributing them to people based on their risk, which of course means age, and I'll leave it to the minister to give details of that. But I want to just remind people that these tests are a tool that helps you determine what activities you can do if you have symptoms. That's when they are best used. And I've talked about this before. They're a red light and not a green light. So if you have symptoms and you want to know if you need to know if they're COVID, then these rapid tests are a really great way of doing that. And then you need to isolate until you're 5 days or until you're better. If you don't have symptoms, if you have symptoms and you test negative, it doesn't mean that all of those other measures that we have in place right now you can ignore. It means that you need to continue taking care, making sure that you're staying away from others until your symptoms resolve. As more tests arrive in BC, we'll be able to expand our availability to even more people, and I will refer people to the BC CDC, and we'll put links again on guidance on how they are best used to support your decision-making for you and for your family in the coming weeks and months. We are also transitioning to what will be our sustainable COVID-19 management strategies we've talked about. And we've been focusing on effective response, recovery, and then readiness for what lies ahead. This means we will be continuing things like our whole genome sequencing surveillance, and I know there's been a lot of concern about potential variants, about variants like the BA.2, the Omicron variant that is increasing in transmission in some countries around the world, like Denmark and the UK. We have seen that here in BC, and more in different parts of the province. It is increasing, but slowly here in British Columbia, and we'll continue to monitor that. We've also been monitoring things like the Delta Omicron variant that has been causing a few clusters, particularly the UK and Australia. We've not yet seen any of those mixed variants here in BC, but our whole genome sequencing program is designed to detect those, and we will continue to look for these. We will also continue to expand our surveillance streams using such things that we've done periodically, like serosurveys, to help us understand how much immunity is in the community. We are in the process of expanding the wastewater surveillance that has proven to be so helpful as yet another marker that helps us understand what's happening. And continuing to monitor things like the PCR test positivity rates, geographic rates of disease and outbreaks and illness. Each step of the way, as we move through this next few weeks, we'll be making our decisions about lifting restrictions, about lifting mandates and orders based on what we are seeing here, where we're seeing transmission, and the data that we have about our pandemic here in British Columbia. And as you know, we are at a different pace, at a different place in our pandemic than many other parts of the world and the country. It is important to remember that while our cases are coming down, COVID-19 is still actively circulating. And I know many people who have children know that we're seeing it in young people, in schools, associated with some schools. We're also seeing it in communities around the province in different ways. We also have seen, tragically, that we still are seeing people dying from COVID-19. Most of them are people who have underlying illnesses, people who are older. However, in the last few days, we've had 4 people in their 40s who've died from COVID-19. That's important. It reminds us that everybody has risk. Right now, we still have high levels of transmission, and if you don't have the protection that vaccine gives you, there is a possibility of having more severe illness and ending up in hospital. So I encourage anybody who's not yet taken that move to think about Novavax as an option right now. Keeping our COVID safety basics are just important today, if not more so than they were last week, as we've started to get back to many of those activities and social activities that we've missed over the last month or so. So I ask that you please be respectful of others as we go through this transition. We can and should all go at our own pace, at our own comfort levels. We need to make sure that we are wearing masks where it's appropriate for us, keeping our distance from people, particularly if we have people in our family, in our community, in our workplace who are vulnerable to more severe illness. It's about moving slowly and gradually in the one-way direction only, so that we don't have to have a turning back of the dial. This means all of us continuing as we've been doing in BC to be accountable to each other, to manage our own risks, and equally important, be mindful and respectful of the risks of those around us. This is our long-term, sustainable strategy that will get us through this transition period and help us deal with what comes next. As Omicron fades, and as we see what comes next in this pandemic, these are the things that will get us through. And on today, on Pink Shirt Day, I remind us that lifting each other up is important, and it is how we will get through this pandemic together, and continue to remind us to do that, and to remind us to be kind with each other. Thank you.
Thank you very much, Dr. Henry. Today I'll provide an update on BC's rapid test inventory and updates on healthcare workers off sick last week and surgical postponements. And we have a slide deck which will be available to the public and members of the media after the presentation that describes the rapid antigen test distribution strategy, and we'll go through that now. I'm going to get some help. The inventory summary, first of all, we've been reporting this week to week, and this is as of February the 22nd, 2022, or yesterday. BC has received 22,242,902 tests. We've deployed 14,843,222 tests, and that leaves 7,399,683 tests in inventory. We're expecting approximately, and this depends on our distribution, when we receive them from the federal government, approximately 3 million tests per week in the coming 4 weeks for 12 million tests. Reminding you that about 558,000 of these tests are not suitable for home use, and although those tests will be continued to be used by public health to support, particularly in dealing with clusters of cases. So if we go on to the next slide, which is not the last week, but this brings us up to February 22nd. You'll see that over the last week, Compared to last week, we distributed a further 4.83 million tests around BC. In the last week, 3.3 million of them went to K-12 schools or post-secondary institutions, and another 418,000 were distributed to other population channels, primarily long-term care and assisted living. And a number of tests, about 865,000, have been pre-positioned for community tests distribution by pharmacies, and I'll get to that later. You'll see on this slide, if we go back to the slide, that we see the overall distribution of tests, which is 12,838,020 since December 13th, 2 million prior to that, and that the largest number so far have gone to education, to long-term care, to healthcare workers, and to COVID testing sites, but they've also gone to rural, remote, and Indigenous communities, to childcare facilities, and most recently to pharmacy distributors. So that's where the rapid tests have gone. Distribution this week, we'll continue to focus in on those. So all of those priority areas that we've talked about will continue to be replenished as tests are used, whether it be long-term care or remote communities or others. We're now, of course, expanding that strategy regarding rapid antigen tests. And what we're going to do is make tests availability easier for people and get them into the hands of more people for their use when they're symptomatic. And Dr. Henry talked about that in her presentation. The next slide. So here are the new approaches. No, that's all right. We got the new approaches to it because, as you can see, the priorities have been the priorities we laid out over the last number of whiles. You've seen the distribution of those priorities. As sufficient numbers of rapid tests have come into place, we're developing new approaches, and you're seeing that in evidence this last week and this week. Previously, we focused on priority high-risk populations. Last week, we announced additional distribution through schools, K-12 and post-secondary, with the important shift of tests now being taken home for use at home by the student and their families if they were to become symptomatic. As we announced last week, that's 5.9 million tests. We're going to go to that purpose, essentially 5 per student. That process has begun, of course, to happen, and you saw a very significant number of those tests distributed last week. This week, we're adding community distribution channels through community pharmacy to make more tests accessible to the full population. So the next slide. What's the same? What's the same is that we're continuing, the focus remains on using the test for when an individual is symptomatic. Focus remains on striving to have tests available, particularly for those who are most at risk. That is, those who are susceptible to severe illness and death from COVID-19, those individuals where testing is clinically indicated, where a positive result would impact treatment or care, individuals who live or work in settings with others who are high risk for severe illness. High-risk individuals continue to be encouraged to seek a PCR test if they are symptomatic. And what is new, we're increasing test availability through existing channels of distribution, and we're creating new channels, such as pharmacies. Increased test availability means more members of the general public will be able to access tests to use to understand their own symptoms and illness and take action to limit transmission to their friends, family, and work, including those at higher risk. And so this is what we've done in the last week. As you see, the distribution update shows that in the last week we've seen this distribution of tests. We'll move on. I spoke about that earlier. And so what's new is the pharmacy distribution, that pharmacies will distribute a rapid antigen test containing 5 tests through this additional channel to interested individuals. There will be no cost to citizens for these tests. More than 865,000 have already been pre-positioned to a pharmacy distributor from which pharmacies can order and receive stocks. Kits will start being available for pickup at select pharmacies as early as Friday, and it is expected that the number of locations will grow rapidly with time and supply. Please check, and there will be a website at the BC Pharmacy Association for a list of pharmacies that are dispensing tests. How will it work? Well, for starters, we're going to use the same approach we've taken throughout the pandemic and focus in on those who are most at risk to severe outcomes from COVID-19. And that means, in particular, those over 70. So that's where we're going to start. Distribution will start for those 70 and over who are amongst the highest risk, as we know. And so in the initial period, you'll need to be 70 or over to get access to these tests. Once distribution has started and supply grows, a broadening to younger ages will essentially go down the age ladder as we have previously. That broadening to younger ages is expected to happen quickly and will be communicated via our government COVID-19 website. Individuals will present their BC Services card at the pharmacy and will be given their kit free of charge. To ensure as many people as possible have access, there will be a limit of 1 kit per person within a 28-day period. You can pick up a kit for a family member, another person. You must provide their name, date of birth, and have their BC Services card with you. And so that's what we're going to do. We're going to be starting for all those at the beginning, over 70, and then moving down the age brackets. This will assist in distribution, in particular, assist those who are most vulnerable to get access to rapid tests. So what do you do if you have a positive test? Dr. Henry has talked about that. There's full instructions on the BC CDC website. I encourage you to go there. And there's 4 things you can do. Report your test at reportcovidresults.bccdc.ca, self-isolate, manage your symptoms, notify your close contacts. And finally, going forward, as more tests arrive and as supply and capacity allows, we'll be providing greater access to all BC citizens. Increased test availability means more members of the general public will be able to access tests to use to understand their own symptoms and illness. So what we've done from the beginning, as we laid out in our plan on December 21st, is prioritize the people most at risk. And the first millions of tests as they arrive were prioritized for that reason. Now we have more tests. And first, last week, out to schools and post-secondary institutions, K-12 schools and post-secondary institutions. And starting the end of this week, through community pharmacies to people in the community, starting with those over 70. And as I say, as more tests arrive, we'll be able to lower the age groups who are eligible to get tests. With respect to a second issue today, the impact of sickness on healthcare workers, we saw a decrease in the number of staff with short-term illness, 14,579 during the week of February 14th to 20th. That's down from the previous week, which reported 15,524 healthcare workers off sick. That's 3,127 in Fraser Health, 2,840 in Interior Health, 1,510 in Northern Health, 1,478 in the Provincial Health Services Authority, 2,044 in Vancouver Coastal Health, 3,018 in Island Health, and 562 in Providence Healthcare. Remember, this is off sick for all reasons, and it continues to be higher than previous periods and previous equivalent periods, say February in previous years, but it has significantly come down. As you know, 2 weeks ago and 3 weeks ago, it was between 17 and 18,000, and now it's down under 15,000 to 14,579. Health authorities with respect to surgeries report that 6,070 surgeries were completed from January 23rd to January 29th. From February 13th to 19th, health authorities postponed 288 non-urgent scheduled surgeries. That's 6 in Fraser Health, 4 in Northern Health, 270 in Interior Health, 6 in Island Health, 2 in the Provincial Health Services Authority. No surgeries were postponed in the Vancouver Coastal Health Authority. Cumulatively, from September 5th, 2021 to February 19, 2022, regional surges of COVID and factors including severe weather patterns have caused 7,925 surgical postponements. As you can see, this was primarily and continues to be primarily an issue in the Interior Health Authority. Our staff there is working flat out to support patients. We are continuing to deliver urgent scheduled surgeries and emergent surgeries in the Interior Health Authority, and we will be making efforts, continued efforts to support that health authority as it deals with the impact of the COVID-19 pandemic. On May 7, 2020, we made a surgical renewal commitment to patients. We said we'd do 3 things. We said we would deliver surgeries that were postponed because of the pandemic. We said we would schedule and deliver surgeries that were not scheduled because of the pandemic. And we said we would change the way we deliver surgeries to get more patients their surgeries faster. As we've reported in weekly updates since then, despite what COVID-19 and severe weather have done to the challenge of achieving these goals, we have done what we said we would do. and we continue to deliver on our commitment. As we reported last week, patients whose surgeries were postponed in this fifth wave have started to get their calls to rebook their surgeries. Patients whose surgeries were postponed in this fifth wave have started to receive their surgeries. Innovations to increase surgical capacity were launched in every health authority across our surgical sites, benefiting everyone in need of surgeries. We will complete the postponed surgeries. We will continue to increase surgeries, and we will improve access far beyond what the pandemic has set us back. Our commitment to change the way surgeries are delivered in BC, that's our commitment, and that is what we are doing, and that is what we're going to continue to do. The patients in all health authorities are getting calls to rebook their surgeries is in large measure because of the work we're all doing, all of us are doing, to stop the current surge. And those calls will continue to occur and will increase in direct proportion to all the actions we continue to take to stop COVID spread. Our work makes all the difference. Your work makes all the difference. And for that reason, our work is not done. And with that, we're happy to take your questions.
A reminder to media on the line, please press *1 to enter the queue. You will be limited to one question and one follow-up. Our first question today comes from Richard Zussman, Global News.
How will pharmacies, this could be for either Dr. Henry or Minister Dix, how will pharmacies ensure that the right people are getting the tests? If somebody shows up under the age of 70, will they be told they can't have a test? How quickly should those under the age of 70 expect to have access? I know in the presentation you said soon. Is that this week, next week, by the end of the month? What's the timeline in that regard? And how do you ensure those that are symptomatic are the ones that are actually getting the tests as you've laid out in the presentation?
Well, a couple of things, and I'll start and see if the minister has things to add. But one is, we don't want symptomatic people to go into a pharmacy and get a test kit right now. That's not, if you're symptomatic and you're in any of the high-risk groups or you need to have a test because of your symptoms, you can go to the symptom screener, get a PCR test, or go to one of the testing centers and receive a testing kit there. These are for people to have at home to use when they need to make a decision about what to do when they have symptoms in the future. So we are prioritizing because we know that there's a pent-up demand out there, and we finally have enough that we can distribute them out more broadly to people. But we want to make sure that the access is that we prioritize access for people who are more at risk, and that's our seniors and elders. We know that. We know they've always been most at risk, and that is for them to have to use either for themselves if they get symptoms, but importantly, to be able to use as a tool to screen people who are around them if they need to. So if you're coming to visit, or if there's somebody that's coming into your center, particularly into your home, particularly if they're concerned about symptoms, this is something that people can use to help manage their own risk around them. So yes, we'll be starting, and we intentionally started with people over the age of 70 so that they would get preferential access at the first. We know that there'll be a lot of people who want them now, and as we get more and more available, they'll be available to everybody. But we want to make sure it's easy for those who are most at risk to get them first. And that's going to happen starting Friday. If we get the supplies that we're expecting over the next 4 weeks, then I fully expect it'll be available to everybody to pick up over the next probably 3 to 4 weeks at the most. And so this is not going to help determine what you do today if you're feeling unwell today, but it is something that will help us for the future, for the next few weeks and months. But really importantly, these are tools that we can get used to using in certain situations for helping self-manage our own risk and the risk of our families. And so we know that a lot of younger families will be getting the test kits through schools. Many people are getting access through their workplaces. So we want to make sure that with this first tranche that's coming in, we're prioritizing it and making it easy for elders and seniors to get access as well. And where it will be important is as we move through this transition period now, and hopefully continue to see cases decrease in communities, when we start to see sporadic increase in cases of respiratory illness next fall, maybe, or even before, if that happens, then people will have these tools at home that they can use to help self-manage their risk. Did you want to add anything?
So, Richard, we laid out two sets of priorities. The first were students in K-12 and post-secondary education, and those have been going out and will be distributed to them. That's 5.9 million tests, and so that with test packages of 5 is more than 1 million people, which is significant to focus on that group of people. As we make the tests available to broader public distribution, we're starting with people 70 and over. So those are the ones who would have access in the initial period to the tests, and that those age groups will go down, as we've seen with other things, for example, vaccination. So you provide your date of birth and your BC services card or your health number, and get access to the test, to your package of tests, so that you'll be able to have that at home. It's a good way to distribute them. It ensures, I think, a common distribution, and it focuses the tests initially on those that most at risk from COVID-19. So it'll be something that people will understand well, and of course all the tests will be provided free of charge to people in BC.
Richard, do you have a follow-up?
Is there any update, I think probably for you, Dr. Henry, from last week when you mentioned that the college are investigating doctors who are spreading misinformation? Is there any update on how those investigations are going, or where we're at with those concerns? And also, we're working on a story tonight of 2 firefighters who were required to get vaccinated, and they produced fraudulent vaccine cards. Is this sort of thing acceptable, and what can the province do to ensure that people are not producing fake vaccine cards to their employers?
Yeah, so with regards to the first, I have no insight into the college's processes that they have to investigate. I did see something in the media that at least one physician there was something happening, but I really can't talk to that. You'll have to talk to the college. I have no way of knowing how these things are progressing, but I know that they do have a process that has gone through. In terms of people providing fraudulent vaccine information, this is something we talked a little bit about a couple of months ago. We do have ways of determining if a vaccine record is a true record, and we were following up on a few, I think it was around 1,000 that we knew were fraudulent records. And so that is a process that the PHSA, our MSBC program, has. And if needed, when I know there was at one point some people making profit off of fraudulent vaccine records, that police would be involved. I can't speak obviously to these 2 individuals, but I will say there is a new option now if people had concerns about the vaccines, if they had worries about confidence in the effectiveness and the value of the mRNA vaccines, that they have other options now, including the Novavax vaccine that was just approved for use. So I would encourage people to get the protection that you need, especially if you're in an important position like an emergency responder like firefighters are. Did you want to add that?
Next question comes from Maria Weisgarber, CTV.
Hi there. I was curious with the distribution of the free rapid test kits now through schools for K-12. Will the gargle tests also still be made available through schools? I know those were being offered as well for a while for students who are symptomatic at school.
Yeah, so the gargles is a way of collecting, a less invasive way of collecting a sample for a PCR test. And yes, absolutely, we still have gargles available for younger people, also for adults who don't like having a swab stuck up in their nose, and those are available. I know some of the schools are still using those. So the rapid tests serve a different purpose. So they are ones that you can take home to help support those decision makings if and when you develop symptoms at home. So slightly different purpose. They're more thinking about how we manage in the future. But absolutely, the gargle tests are still available at all of the testing centers, and I know are easily accessible in some of the schools. I know it's a little bit of a different program in different parts of the province, but absolutely they are the PCR tests.
Maria, do you have a follow-up?
Yes, I was curious about the online reporting. I know that the province has indicated if people get positive results on their rapid tests, they're asking if people would report results online to the BC CDC. I'm curious about the rate of uptake with that, if there have been many results being reported, and now that there's going to be a wider distribution, is the province still putting a lot of importance on people voluntarily self-reporting if they get a positive result?
Yeah, so it's a bit of a challenge. It is one way of helping us understand, how many people are getting a positive test on the rapid test. But there are many, many limitations, and that's one of the reasons why we're not including it as a routine surveillance stream, because, as you know, the access to tests is changing, and it's only numerator data. So we don't actually know how many tests have been used at any point in time. So it doesn't give us a sense of what proportion of people are testing positive. It does give us a little bit of an idea from in a different community, for example, on who is testing and who is testing positive of the people that are testing. So it really is limited information, and it will be potentially a useful tool, not so much right now when we still don't have a lot of, as access to testing is increasing to the rapid tests. But it can be something where we can target people being able to download that information in a specific community. I'm thinking in the future, if we get down to a nice low level of transmission, and then we see respiratory illness going up in a certain community, we can target that community and say, hey, if you're using the rapid test, please let us know if you're positive. And so it is an important tool that we don't yet know all of its how it can be used. We've been talking with colleagues in the UK in particular who've had rapid tests in the community available for quite a long period of time, and do have a very similar voluntary reporting online. And there are limitations to that, so we're still trying to figure out where it's most of value.
Next question comes from Lisa Yusta, City News.
Hi there, I'm asking a question on behalf of a colleague, and regarding long COVID. I'm wondering, with Omicron and the faster incubation period, we're hearing from people who are finding that at 2.5 months they're feeling like they're having long COVID, and their doctor thinks they are, but they can't get into the clinics yet because there's a 3-month cutoff. So I'm wondering, is the criteria at this point too narrow? Is it going to change as, I guess, more people have become infected? And I'm wondering, where you're at with that and what you have to say on that.
Yeah. So there's lots of, there's actually some really good information that's come out of a number of other countries, particularly the UK, who started following this through their family physician clinics, primary care clinics. So yes, by definition, one doesn't meet the criteria for long COVID until 12 weeks from your infection. So that's a standard definition that people are using around the world. It doesn't mean that people don't have symptoms in that period of time, but many people, they'll resolve within 12 weeks. So that's one of the sort of case definition cutoffs. The other thing that we're finding is that vaccination, if you get infected after being vaccinated, and we're seeing that more commonly now with Omicron, your risk of developing long COVID is considerably lower, much more, 50% at least, but considerably lower. So that's good news, and that goes back to Delta as well. And the number of people who truly have long COVID symptoms that persist is probably less than initially thought. So the data from the UK looks at probably 5 to 10% of people, and that's pre-Omicron. So we're still trying to figure out, as you know, Omicron really burst onto the world stage less than 12 weeks ago, so still trying to understand it. One thing that is clear is that there are a variety of different symptoms that have been consistently associated with people having long COVID, and it reminds us that this is a virus that affects more than the respiratory symptoms, the respiratory system. It has effects on our blood vessels, on our blood system, on our heart, and on a neurological system. So people are, as you mentioned, and talking about brain fog, but things like having loss of taste and smell that can last for quite a long time, and other things that can be more debilitating. So we are still learning a lot about this, and it doesn't mean that if you're feeling really unwell in that period of time, there aren't things you can do. And what I would encourage you to do, if you have a family physician, talk to their family physician. There's the race line, the support line, that the family physician can call to get advice on things that we know can help people get through those symptoms even before 3 months. We know that things like getting rest, those basics that help us get over infections in the first place, but making sure nutrition and getting rest and exercised in a managed way are things that can help a lot too. And that sounds like motherhood things, but those are very important things for helping recover from viral infections.
Lisa, do you have a follow-up?
I do. Regarding the rapid tests and schools, sort of twofold question. Well, I think a lot of parents were under the presumption that their child, like each child, was going to get a 5-test kit, and so there's some frustration with that. And I think when people see 7.4 million sitting in the inventory, wondering why can't they all just go out now? And also, a question was asked: if schools are not vectors of transmission, which have been told all along, why are schools being focused on to get these rapid tests?
Well, I'll start and then I'll turn it over to the minister. But if we talk about 7 million tests, and this is one of my frustrations, my pet peeves. They're not 7 million individual test kits of 5. They're so divide by 5 to think about how many test kits there are there. And initially, the tests that we were distributing through schools were ones that we had broken down from kits of 25 or 35 into 3 or sometimes single kits. So I know some of those have gone out through schools, but the new ones that have come in that were started to be distributed last week come in a box, and there's 5 tests in the box with the reagents, and each child in a family. So if you have 3 children, each child would get one of those boxes of 5. So that's how we're going to be moving forward with it. So we know that schools themselves are not amplifiers, but we know that all of those activities that kids in school can have COVID. And so what the purpose of the rapid antigen tests, and this is something, the at-home tests in particular, this is something that we've been looking at for several months, expecting that we would get more in finally. So it's not it's to help manage you at home. So if you're at home and you get up in the morning and your child has symptoms, it's a tool that can help you determine whether your child should go into school today or not. So it's for the future, for helping us manage and self-manage and look after ourselves. If if our child is sick this morning, or if we get a test and we're not feeling well, you can make those decisions about whether you're going to go visit an elderly person or whether you need to stay away from your grandparents for a couple of days. So it's to help you make those decisions based on what's happening for you. So I think about it as we often in medicine will do the test and say, if you don't hear from us, then everything's fine. Well, this is the other way around. You have the tests, you use them. And if they're positive and you have concerns, then let us know in the healthcare system. So I think it is a tool that it's not going to solve all our problems, but it is something that people can use to help them make decisions. And it will help us through this next few weeks and months. But it is something, a tool that we hope will be able to help us as we transition through this pandemic phase and going forward.
And as you can see, because we've been reporting on this every week, we get new rapid antigen tests in from the federal government and we distribute them. We started with the priorities that we had that we laid out on December 21st, which is to support testing centers, support healthcare workers, support long-term care and assisted living in rural, remote and indigenous communities, 2 K-12 education, 2 post-secondary education, 2 child care. And these were our priorities, and to support congregate living in different places. And all of those areas that we prioritize have now received sufficient rapid tests to take them into the future, and they'll continue to be topped up. We now have more tests available. We're making them available to students in that system, which I think will be of assistance to parents, and to those most vulnerable, those over 70, and we're going to move our way through. And really the thing that will decide how quickly we move through age groups, it will be how quickly we get rapid tests in. So we moved a very significant number of rapid tests to schools last week. We've started the process of going through community pharmacy, and so you see the results of that. As we get more in, we'll distribute more out, and we'll be able to drop the age of where people will be accessible. So a lot of people will have access to rapid tests in the coming weeks, and that will continue to be the case as they become available.
Next question comes from Rob Monroe, Info News.
Hi, thank you for this. Dr. Henry, in looking at the numbers of cases and hospitalizations and such, the Interior seems to be declining a bit slower than the rest of the province. I know you've said in the past that Omicron came to the Interior later than the Lower Mainland. Is this just a factor of it's taking longer to work its way through, or are there other factors here?
I think there's a couple of different factors. One is they were still dealing with quite a lot of Delta, and it was a bit later that we saw the Omicron surge. But it also reflects the fact that in a number of communities in the interior, and we're seeing this in the north as well, there's lower rates of vaccination. So the virus has much more opportunity to infect more people, and we're seeing that reflected in the numbers that we're seeing in the interior and in hospitalization. So it has meant that the peak has been delayed and also going down more slowly. And the proportion of people in hospital is a little bit higher. But we've seen turning the corner. The other thing that we're also watching is what proportion of cases are the BA.2. We are seeing a little bit of an increase in that. It is more infectious. It doesn't seem to cause more severe illness, but again, more infectious in people, particularly who haven't had their booster dose, who aren't vaccinated. And so that's important too as one of the drivers in some communities.
Rob, do you have a follow-up?
Yes, I do. I just don't know, too, whether there's a concern with Alberta loosening their regulations, and they tend to come to the Okanagan. And do we have any indication that they're bringing that here? And what are you doing to try to get that vaccination rate up in the interior?
Yeah, I know Interior Health is doing lots to try and encourage it and provide information, and it really is going back to those basics, ensuring that people have the information they need to be confident in the vaccine, that it's accessible and convenient for them, and to get over that sense of complacency. And I think we've seen that a little bit with Omicron, that there's this narrative that it is a mild disease, and it is a mild disease in people who have that immune protection for the most part, not in everybody, but for people who have vaccination, is particularly if you have 2 doses of vaccine on board, then for most people it has been a relatively mild experience. It doesn't mean that it's the same for everybody. And we see that in people who have died. And we see that it is older people, even with vaccination, who are still most at risk. So we need to take those measures to protect them. I would also say that, for everybody in the interior who's not yet, there's a lot of concerns in some communities. There was concerns about the mRNA vaccines, and I think this is a very effective alternative for you. And I encourage you to call the call center, the 1-833-838-2323, and put your name on the list to get your vaccine as soon as possible. And yes, we do see there's quite a lot of people moving back and forth between Alberta and parts of the interior and the north. What we need to say is, when you're here, we expect you to do the things that we're all doing to protect each other and our communities here in BC. So that's following the guidelines that we have in place, making sure that you do avail yourself of the opportunities to get protection through vaccination.
Next question goes to Cole Skizler, Black Press.
Cole Schisler. Thank you for taking my question. It's not long COVID. So to access the post-COVID-19 recovery clinic, people need to have a positive COVID-19 swab or a positive serology test. During the peak of our Omicron wave, testing capacity was limited here in the province. So for people who were unable to access a test because of lack of supply, who may have got Omicron and may now have long COVID, what supports are available for those people?
Yeah, so there is a serology test, as you mentioned, that can tell whether you've had an infection with COVID. So that's one of the things that the clinic can do. So again, it's talk to your family doctor if you have one. You can call 811 to get advice about how to do that. But talk to your clinician, make sure you can get that the signs and symptoms are assessed. Your physicians and nurse practitioners can get direct access to clinicians who are working in those clinics. We only, they're not available in every community, but they are designed to be a hub and spoke so they can support your family physician in your community in supporting you as well. And part of that assessment, if you've not had a test and you have had COVID-like symptoms, is to get a serology test that will help understand if you were infected or not. And yes, you can tell the difference between some of the immune markers from vaccination versus from infection. So that is available, and the clinicians in the post-vaccination or the post-COVID recovery clinics can provide advice on how to get those tests if they're indicated.
Thank you. Cole Schisler, do you have a follow-up?
Yes, thank you. Does BC recognize long COVID as a disability?
Yeah, that's a very good question. So it's not our role to recognize a disability. It depends on the symptoms that somebody has. And it would depend on the circumstances that they have. So if somebody for work, for example, it would go through things like WorkSafe BC assessments to determine if it was a work-related disability. So yes, some people who have long COVID do have disabilities, but it's specific to the individual, and it depends on what signs and symptoms they have and how it affects them. So that's a discussion that's between an individual and their clinician about how the illness is affecting them individually.
We have time for one more question today. We'll go to Karen Larson.
So, Dr. Henry, how do you explain what appears to be a relatively low rate of vaccination for 5 to 11-year-olds?
Yeah, well, this is something, actually, we had a long conversation about that with colleagues across the country as well as some international experts just today. This is something that we're seeing across the board. if we look at, we're at about 55% here in BC, and that's about the same as Ontario, Quebec, and most of provinces across the country, with the exception of Newfoundland and Labrador, where they have overall much higher immunization rates. It is also aligned with the polling. Early on, before vaccine was available, we asked parents about intentions to vaccinate younger children. So I think there's some, and it's what we heard. We heard that about 50% of parents were going to sign up right away. And then there was a proportion of people, 20 to 30%, who wanted to understand more and wait until they saw more information, more data about the vaccine. We now know quite a lot more about how COVID is affecting that younger age group and about the safety of the vaccines, how well they're working. So we are all at a point now where we need to look at, okay, what do we do to provide that information that parents are looking for and to support them in getting children vaccinated? So again, I think it is important. We have seen, and we've seen in our data here in BC, a higher number now of younger children because it's been, Omicron has been transmitting so widely. We're seeing more children need hospital care. Thankfully, it's still quite low in terms of rates, but it does mean that the more children who are affected, the more children will have severe illness and end up in hospital, either from exacerbation of asthma or other illnesses or from COVID itself. So it is important to protect children, and now we have a lot of information about how well these vaccines work and how safe they are. It's also, I believe, really important for helping to get us through these trying times for children, particularly in schools, to make it easier for them to participate fully in activities and not worry that they're bringing it home to family members who may be more vulnerable. So there's a whole lot of reasons why it is important to continue to provide the information that's needed and for children to be vaccinated. And I really encourage parents, talk to your pediatrician, talk to your pharmacist, talk to your public health nurse in your community, because we have lots more information now that really support how safe these vaccines are, how well they work, and the impacts that COVID has had on younger people. Because we do need to get those immunization rates up. I think it's going to be really important for getting us through this transition phase, but also for protecting young children for what comes next.
I think, and we'll share this with you, Karen, which you may be interested in, with reporters. If you go from the age of 17 down and under 18, every time you go down 1 year age cohort, the number of people, youth or children vaccinated gets less and less. So 17 and 16-year-olds are actually vaccinated above the provincial average of vaccination, then it declines. Every individual year cohort down to age 5. And the other thing we see in the numbers is, well, there isn't a great deal of difference between adults over 70 in different parts and living in different health authority regions in the province. There is a significant difference between children 5 and 11 as by health authority, with the highest levels of vaccination for children 5 to 11 being in Vancouver Coastal Health above the 70% mark. So those are the basic informations pour dire en français que je pense que nous allons continuer à nous efforcer de communiquer le message. C'est-à-dire que ces vaccins sont très efficaces et c'est très important pour des enfants de 5 à 11 ans de recevoir leur vaccination. Et on va continuer ce travail. C'est à peu près 56% maintenant. Le nombre de gens qui ont reçu, d'enfants de 5 à 11 ans qui ont reçu leur deuxième dose continue à augmenter. Et je pense que cela démontre que 56% de la population sont déterminés que leurs enfants soient vaccinés et que les autres ont des hésitations, et il faut travailler. On a démontré depuis des mois l'efficacité et la protection donnée par ces vaccins. Et il faut continuer à travailler avec les parents. Et c'est ce que les parents ont indiqué avant le commencement de cette affaire et il faut maintenant continuer à travailler avec eux pour mieux communiquer ces renseignements pour que des gens soient en mesure de prendre des décisions appropriées.
Karen, do you have a follow-up?
Yes, I do, and English and French again, if you could please. Minister Dix, is there anything the province could have done differently than to try and increase those numbers of the 5 to 11-year-olds or to convince parents to vaccinate their children? And should we expect a different strategy?
Yeah, so, we had a very intentional strategy based on the information that we received from parents and from guardians and from community members about what they were looking for in vaccinating children. So we have done it in a whole variety of settings, but we really have focused. The things that we heard that were most important were having immunizers who were used to dealing with children and being with children, and having clinics that were designed to make it an experience that was as least traumatic as possible for children. So we've done that, and you see as we're transitioning to much of the mass clinics being scaled back, we're focusing on having those important experiences where you can bring your child, even if they have concerns, even if you're worried that they're going to scream or be upset or be concerned, because we know that the people there at those clinics know how to make this an experience that's positive for children, and to make sure that they are vaccinated in a way that supports them. That was the number one most important thing. So we have been focusing on that. Having said that, in different communities, we have tried and worked on many different aspects of the supporting families, making sure it's in a place where they feel comfortable, in a language that they feel comfortable, the information is in a format that resonates and that answers the questions that parents have. So there's a lot that we've done, and we will continue to follow along with that strategy, a parent, a family, a community at a time, to make sure that we're providing those opportunities for all young people to get vaccinated. And I mentioned we were on this call, this is something that we're seeing in many communities around the world, and that it is really about addressing what I keep calling the 3 C's. So, complacency, the sense that children aren't at risk. Convenience, making it easy for parents, making it in a language that they understand, in a setting that they feel comfortable. All of those things are really, really important. And confidence in the vaccine. And as we have more and more young children vaccinated, and we've seen the effects that COVID is having, particularly Omicron, over the last few weeks, we have more and more information to build confidence and to share with parents. So we will continue to really focus on addressing those needs for families and for parents and for children.
And as you know, 93.5% of adults over 18 have received their first dose COVID-19 vaccination. Over 91% have received their second dose. Of those eligible, well over 60% of adults have received their booster doses. So I think there's a strong understanding of the need for vaccination. We talked to people prior to the approval of the pediatric vaccination from 5 to 11. Many parents told us that they wanted to wait a while. Well, 200,000 children now have, or just under 200,000 children have received their specially designed pediatric vaccine, and it's proven to be effective, it's proven to be safe, and I think this is a moment we're going to continue to see parents bring their children to be vaccinated. So we're continuing to grind those numbers up slowly, and I expect we'll continue to do so and that we'll succeed in it. I think one of the differences between the availability of vaccines for adults and the availability for children, it was a little different. You'll recall that we got access to the vaccines on December 13th or so of 2020 for adults. But because of supply, it was quite a bit of time before most adults had access to them. We focused on long-term care and other things, so people had time with it. Whereas with the pediatric vaccines, basically we had sufficient vaccine immediately. So that period, which some people took to wait and consider, was not available. And so we believe, strongly believe, that the evidence is so strong that it makes children safer, that it makes their families safer, that it will make everywhere around them safer, that we're going to continue to see those numbers go up. There are regional differences, though, and so we have to continue to provide information. You saw that Fraser Health put out an information bulletin today about some new places where the pediatric vaccine will be available. And what I would say is, and what will continue, is a real focus of public health on ensuring that the people doing the vaccinations have lots of experience with children. And the experience that I've heard from parents is how positive it has been at our vaccination clinic, and that has everything to do with the extraordinary work done by public health nurses and doctors and others. Je dirais en français qu'on va continuer et y travailler, n'est-ce pas? C'est 56% un peu partout dans la province. Mais on sait bien que les parents, c'est-à-dire des gens, des adultes dans la société, sont vaccinés à 93,5% dans toute la population pour la première dose et 91% pour la deuxième dose, ce qui indique un soutien remarquable pour la vaccination contre le COVID-19. Cela a pris du temps pour avoir assez de vaccins. Pour les adultes, ça a commencé en décembre de 2020 et continué, et c'était vraiment en avril, puis au mois de mai, puis en juin qu'on a reçu le grand nombre, on a fait le grand nombre de vaccinations, et puis juillet, etc. Donc il y avait du temps. Et alors qu'avec les enfants, on avait les vaccins au commencement de la campagne. Donc, je pense que c'est un peu différent, mais on continue à y travailler, de faire en sorte que ça soit plus facile pour les parents et pour les enfants. Et on va prendre des bonnes suggestions et comme vient de faire le Régie de santé de Fraser, on va continuer à offrir plusieurs opportunités pour des enfants d'être vaccinés. Merci beaucoup. Thank you very much. See you next week.